In North Carolina, employment support and public health programs are critical to the economic strength of the state and the well-being of its citizens. Each day, managers of Work First and public health nursing programs throughout North Carolina work to ensure employment and health supports reach the people in need in each county. They are also charged with seeking new and more effective ways to improve employment and health outcomes, but often with too few evidence-based programs to guide their actions, or too few resources to implement them. Work First and public health nursing program managers often serve the same population within each county, but are working on separate problems. While one focuses on health and the other on employment, these issues are interconnected in communities. What if, by joining forces, Work First and public health nursing managers could strengthen the health and employment outcomes of the people in their counties? As it turns out, they can. In a recent study funded by the National Institutes of Health, by coordinating services to address a broad range of health needs among Work First clients, managers were able to improve both health and employment outcomes. In this short video, we'll explain why addressing a broad range of health problems for this population makes sense, what the model looked like that was tested, and the health and employment outcomes you could expect to see based on the specific characteristics of the populations you serve in your county, how to coordinate and implement services across Work First and public health programs step by step. Let's get started. First, why the focus on health? Although not widely recognized, studies have shown that health problems are an even greater barrier to employment for Work First clients than low education, lack of work experience, and having very young children. Of the high rate of health problems are in this group compared to the general population. For example, 44 to 50% report a physical or mental health impairment, compared to 16% of the non-Work First adult population. Over 50% meet screening criteria for depression. Other chronic health conditions, such as headaches, back pain, and simple problems like seasonal allergies are known to interfere with functioning. 48% of TANF clients identified a health problem as their primary work-related barrier. In 28% of TANF clients, health problems limit the amount or type of work they do. But only 3.5% have conditions severe enough to be eligible for Social Security Disability Income, SSDI. Those with health problems work 5.4 fewer months per year and are less than half as likely to work 20+ hours per week. Current approaches widely used to screen and refer Work First clients for domestic violence and mental health problems have not been shown to improve health or employment outcomes. Despite this, there is a new program model that is well-tested, evidence-based, and has been shown to improve both health and employment outcomes for Work First clients. The public health nursing case management model for welfare to work participants was developed in partnership with program managers, public health nursing experts, and clients enrolled in Work First equivalent programs in Florida. It was tested in nearly 450 women. Consistent with a one-stop focus, public health nurses were placed on-site where welfare to work services were provided. Much like what is currently done in some Work First programs, the nurses provided initial screening and referrals as soon as clients began their job search or training activities. However, the on-site public health nurses also screen for all mental and physical chronic health conditions that can interfere with a client's ability to function well in employment settings, assisted clients in making healthcare appointments they were referred for, showed clients how to navigate the healthcare system using Medicaid, focused on helping clients get their health-related symptoms under better control through intensive education about their conditions, medications, and self-management strategies, collaborated with primary healthcare and other providers directly when needed, provided follow-up and case management of clients' health issues over a 9-month period as they moved into employment settings. By implementing this model, women with a history of depression were 2 to 3 times more likely to attend a referral for a mental health visit. Depressive symptoms improved. everyday functioning improved. There was a 9% increase in women moving into employment who received public health nursing services compared to the group that did not receive these services. Women who received services from the public health nurse on average moved into employment 35 days earlier than those who did not. You may be thinking, this sounds like a great model, but what would happen in my county? Well, let's take a look. Adopting this evidence-based approach is not difficult. Collaboration between public health and Work First program managers is the key. Across the board, Work First clients, public health nurses, and Work First administrators were highly satisfied with this intervention. By putting this intervention into practice, your county would contribute to North Carolina's long history of being a leader in adopting innovative, evidence-based best practices to improve health and employment for its people.